Chlamydia is very common. Each year, millions of people around the world get chlamydia. In the United States, it is the most common infection you can get from sex. Young people get chlamydia the most. People between 15 and 24 years old have the highest rates. But people of any age can get it. Many people do not know they have it. This is because chlamydia often has no symptoms. This is why numbers might be even higher than we know. If you are sexually active, it is a good idea to learn about chlamydia. It is more common than many think, and anyone can get it. Chlamydia is a common sexually transmitted infection, and understanding how it spreads is important for protecting yourself and your partners. Chlamydia spreads primarily through sexual contact, which means it can be passed from one person to another during intimate activities. This includes any kind of sexual activity involving the genitals, such as vaginal sex, where the penis enters the vagina. Chlamydia can also be transmitted through anal sex, regardless of whether it is between same-sex or opposite-sex partners. Even oral sex, where the mouth comes into contact with the genitals, can spread the infection. It does not matter if it is your very first time having sex or if you have had many partners before. Chlamydia can affect anyone who is sexually active, no matter their age, gender, or sexual orientation. One of the reasons chlamydia spreads so easily is that many people who have it do not show any symptoms. You can get chlamydia even if your partner looks and feels completely healthy, and even if they are unaware that they are infected. In fact, most people with chlamydia do not know they have it, because the infection often does not cause noticeable signs. This means someone can carry the bacteria and pass it on to others without realizing it. It's important to know that chlamydia cannot be spread through everyday contact. You cannot get chlamydia from hugging someone, shaking hands, sharing food or drinks, or sitting next to someone at a table. You also cannot catch chlamydia from using the same toilet, sharing towels, or swimming in pools or hot tubs with someone who has the infection. The bacteria that cause chlamydia do not survive well outside the human body. If you do not use protection, such as condoms or dental dams, during sex, your risk of getting chlamydia is much higher. These barriers help reduce the chance of the bacteria passing from one person to another by covering the areas where the infection can be transmitted. Using condoms or dental dams every time you have sex can greatly lower your risk, but it is important to remember that they are not 100% effective. Chlamydia can sometimes be spread from areas not covered by a condom, or if the condom is not used correctly. The only way to completely avoid the risk of chlamydia is to not have any kind of sexual contact. Choosing abstinence is the surest way to prevent infection, but for most people, using protection and getting regular sexual health checkups are practical ways to stay safe. Understanding how chlamydia spreads can help you make informed and safer choices about your sexual health. Being aware of the risks and how to reduce them is an important part of taking care of yourself and your partners. It's always okay to talk openly with your partner about sexual health, past partners, and STI testing. Honest conversations can help both of you feel more comfortable and confident in your relationship, and can protect you from infections like chlamydia. Chlamydia is one of the most common sexually transmitted infections, but what's surprising is that it often does not cause any symptoms in men at all. In fact, many men who have chlamydia might not even realize they're infected because they feel completely fine and healthy. This is why chlamydia is sometimes called a silent infection. It can quietly linger in the body, sometimes for weeks or even months, without causing any obvious problems. However, when symptoms do appear, they usually start to show up about 1 to 3 weeks after having sex with someone who has chlamydia. This delay can make it tricky to connect the symptoms to the infection, especially if you don't remember any risky encounters, or if you've had multiple partners. It's important to keep in mind that even if you don't have symptoms right away, you can still pass chlamydia to others. The most common symptom that men notice is a burning or stinging feeling when they pee. This discomfort can range from mild to quite painful, and it might be easy to brush off as just a minor irritation or dehydration. But if you notice this burning sensation, especially if it doesn't go away after a day or two, it's a good idea to pay attention and not ignore it. Another sign to watch for is a discharge from the tip of the penis. This discharge can be clear, cloudy, or even slightly yellowish. It might be most noticeable in the morning or after you haven't peed for a while. Some men might also notice a strange smell or a sticky feeling. If you see anything unusual in your underwear or when you go to the bathroom, it's worth getting checked out. Pain or swelling in the testicles is another possible symptom. This can happen on one or both sides, and it might feel like a dull ache or a sharp pain. Sometimes the testicles can look a bit larger or feel tender to the touch. While this isn't as common as other symptoms, it's important not to ignore any pain or swelling in this area, as it could be a sign of a more serious problem. Some men also experience pain or discomfort in their lower belly or lower back. This can feel like cramps, pressure, or just a general soreness. It might come and go, or it might stick around for a while. These aches can be easy to dismiss, but they can be a sign that the infection is spreading. The tricky thing about chlamydia is that these symptoms can be very mild, and honestly, pretty easy to miss or ignore. Some men might think they just have a minor urinary tract infection, or maybe they blame it on stress, dehydration, or even too much exercise. It's common to shrug off these signs, especially if they don't seem serious. Unfortunately, ignoring these symptoms or hoping they'll go away on their own can lead to bigger problems down the road. Chlamydia can cause complications if it's not treated, including pain, swelling, and even fertility issues. Some men might not realize how important it is to take these signs seriously, and they might avoid talking about it out of embarrassment or fear. That's why it's so important to pay attention to your body and notice any changes, no matter how small they seem. If you see something unusual, feel pain, or just have a gut feeling that something isn't right, don't ignore it. Reading up on symptoms and being aware of your health is a great first step. If you notice any changes, pain, or discomfort, the best thing you can do is talk to a doctor or healthcare professional. They can help you figure out what's going on and, if needed, do a simple test to check for chlamydia. The test is quick, easy, and nothing to be embarrassed about. Getting checked early and getting treatment if you need it can keep you healthy, prevent complications, and protect your partners too. Remember, taking care of your health is always the right choice, and you don't have to go through it alone. Like men, women often have no symptoms from chlamydia. If there are symptoms, they can also start 1 to 3 weeks after getting the infection. The most common sign is an unusual discharge from the vagina. Women may also feel pain or a burning feeling when peeing. Some women have pain during sex. There can also be pain in the lower belly. Other symptoms can include bleeding between periods or after sex. These symptoms can be easy to miss or confuse with other problems. If you notice any of these signs, see a doctor. Early treatment can prevent more serious health problems. Many people with chlamydia do not have any symptoms at all. This is very common. In fact, most people who have chlamydia do not know it. You can feel healthy and still have the infection. That means you can also pass it to other people without knowing. Not having symptoms does not mean you are safe. Some people find out they have chlamydia only after a partner is tested. That is why regular testing is important if you are sexually active. Even if you feel fine, get tested if you are at risk. It is better to know early and get treated. Testing for chlamydia is quick and easy. It usually involves a urine test or a swab. If you have chlamydia, you can be treated with medicine. If you do not treat chlamydia, it can cause serious health problems. In women, it can lead to trouble having babies later. In men, it can cause pain and swelling in the testicles. Chlamydia can also make it easier to get other infections like HIV. Treating it early helps you stay healthy and protects your partners too. Do not wait for symptoms. Testing is the best way to know for sure. Early treatment can stop problems before they start.